Heart disease remains the leading cause of death in the U.S., but for many people living in rural Connecticut communities, access to early screenings and preventative care can be quite a challenge. We are taking a closer look at how Hartford HealthCare is expanding services in underserved areas. Joining us today live is Dr. Lisa Cantor, a cardiologist at Hartford HealthCare. Welcome, Dr. Cantor. Thanks for joining us on Good Morning Connecticut at 9.
Thank you for having me.
So thank you for drawing awareness to this very important topic. Give us a sense of why rural communities have a harder time accessing these early and preventative screenings.
So some of the problem is just access to primary care, access to specialists, access to testing, and also distance. If you look at the map of Connecticut, we're in the quiet corner, which direction-wise may not seem that far, but we're talking back roads. It's from our area, it's almost 30 minutes to the highway. So again, access is key, access to early prevention, because it's much more important to prevent the disease before it occurs than treat the consequences down the line.
Absolutely. Dr. Cantor, are there any areas in particular that Hartford HealthCare is seeing the most challenge when it comes to access to these crucial services?
Sure. I think that physicians and also all of the other team members, because it really is a team, from nursing to technologists to even access to getting the test done. There's a shortage all across the board, and it hits hardest in the rural areas where it may be challenging to recruit and retain physicians and other clinicians.
Absolutely. And like you mentioned, the distance, and I can imagine for some patients, transportation in order to see their doctor is a challenge as well. So how is Hartford HealthCare working to improve access to this critical preventative care?
So, the standard is recruiting, but also thinking outside the box. And telehealth, really, that we learned and got good at during COVID has been a tremendous gain. Because if we have somebody who may not be able to drive 20, 30 minutes, a telehealth visit, at least to bridge, expanding urgent care, and understanding what's appropriate for urgent care. And also the out-of-the-box thinking of a 24/7 platform for telehealth, so it's not just limited to the 9 to 5 weekday hours. That's really been a significant improvement in at least identifying patients who may need an earlier intervention.
Yeah, telehealth, of course, as you have outlined here, is absolutely a very helpful tool. And talk to us again, doctor. I know you've been stressing this throughout the conversation, but why is having access to a primary care doctor so important when it comes to helping patients reduce their risk of heart disease?
Sure. I think just identifying what risk patients may have. If they never go to a doctor, they're not going to know if they have high blood pressure, high cholesterol, diabetes. And you look at the standard risks for developing heart disease. Family history is critical. And in our rural areas, believe it or not, we see generational families. So you actually may identify some of those high-risk patients early on. But knowing your numbers, knowing what your blood pressure is, knowing what your cholesterol is, knowing if you have diabetes or not, and trying to help encourage maintaining a healthy lifestyle, including sleep, exercise, diet. All of these things come into play in just the regular routine office appointment.
Really good advice. Dr. Cantor, we thank you for your time today.
Thank you very much. Have a great weekend.